Good morning, Dr. Turner.
Good morning.
I'm really excited today because Dr. Steve Hosea is on the podcast.
He's been a friend and colleague for almost 40 years, actually more than 40 years, and has really been in the trenches with infectious disease ever since he started practice in Santa Barbara, with initially the AIDS endemic and then more recently COVID. It's really interesting what he has to say from this unusual position of being an expert in infectious disease. This is really informative.
Yeah, it was really great talking to him. He's also someone I'd like to have over for dinner sometime, just letting you know.
I'm sure we can do that.
Enjoy the show.
But what do I know? I'm just a vagina doctor. Steve Hosea, friend, colleague of 40 years. Welcome to the Vagina Doctor podcast.
Thank you.
It's great to see you here today. We came to Santa Barbara about the same time, and I was in 78, and I think you were 81. You're an infectious disease specialist and trained at Harvard and spent 10 years with the National Institute of Health.
Correct.
But did you think, when you first went into infectious disease, that you would be dealing with a couple of planet-shaking epidemics of HIV and then COVID? I mean, and would that have changed your mind had you had that foresight?
I know I never thought or dreamed that would happen, although doing infectious diseases, we know there's always a potential for an epidemic at any time. And it's really a matter of not if it's going to happen, but when it's going to happen. So certainly HIV was unanticipated. COVID was totally unanticipated. And it has been, for me, a matter of awe watching what natural selection and infectious diseases can do, let run rampant. And not that we could keep it from running rampant, but I think that's what happened with COVID anyway.
Yeah. It's, I think of going back to the HIV, we didn't have a clue what was going on at that point. And I would see physicians or providers, dressed head to foot and in protective gear just to touch a patient, go into the same room. We did, as we learned more about it, it became so, but it must have been horrifying. And same with COVID to an extent.
Certainly it was, especially with HIV. I can remember some of the first patients that I had at Cottage Hospital. I would go to see them sometimes in the evening, and all 3 trays from their meals were sitting outside because the food servers were afraid to go into the room to deliver those. So I would deliver the trays of food to them. Wow. Because people were so fearful of transmitting it. It really looked and acted from the beginning very similar to hepatitis B. And we know that that's really not contagious, just person-to-person spread through casual contact. And so that's why a lot of infectious disease people were relatively confident that it wasn't going to be something we're going to pick up just by walking in a room or shaking somebody's hand or not. But that took a lot of training to come to that level of confidence with regard to that. And lay people don't want to catch these things.
Right, absolutely. You mentioned training right there. You're the director of postgraduate education at Cottage, is that correct?
Correct.
Yeah. I was a little involved with teaching residents at Cottage, found it very rewarding. And this is when the minimally invasive surgery came in, so I was just involved with the surgery residents. Found it really rewarding to be involved with that. It didn't last for long because they learned very quickly. But it sounds like that's a huge part of your enjoyment and your passion, as you put it, is your teaching.
Oh, it truly is. Taking young people from being medical students to being physicians over a 3-year period of time is just an incredible, gratifying experience to watch them grow into their full clinical selves and help them become physicians. Because I think medical school gives you the book learning, but what the real learning is on the floor, in the room with the patient, face to face, person to person, dealing with people and helping them deal with their various illness. And that's incredibly gratifying. I feel like it's part of my family. I get to graduate every year who've been there for 3 years because you come so close to them. And it's like being in a foxhole together. Mm-hmm. You go through some very traumatic times together, and those bonds that are formed just are not torn asunder. They're there for a long time.
It's actually, you mentioned foxhole point of view. I was thinking about this discussion last night, and my thought was you were in the trenches. So we were thinking in the same line. It must have been quite like that. What's your week like in terms of seeing patients and teaching residents and so on? What's your Monday through Friday, or actually probably more than that?
Right. Usually at 7:30 in the morning, we have morning report where the residents gather and present cases that have been presented in the last 24 hours, and we have an active discussion about the evaluation and workup and plan for dealing with those patients. And then we go out and see the patients together. Mm-hmm. During that time, if I get infectious disease consults, I'll see them during the day in between seeing some of the internal medicine patients. And then I leave when the day is over. And some days it's over at 4 o'clock, and sometimes it's 8 o'clock. Yeah. So,
there have not been a great number of infectious disease specialists at Cottage in the years that I've been here. Everybody those that have been involved have been very busy. But who's around now? Who is doing what you're doing, other than the education that you're doing with the residents and teaching them? Are there infectious disease specialists at Sansom and or independent in Santa Barbara?
Right. Right now there are, I guess, 4 at Sansom, because I'm at Sansom one afternoon a week. But there's Mary Louise Scully and Andrea Zambrano and Thedra Galfine who are there. And Dave Fisk was there, but he's now working more as an independent in the community, covering. And then, unfortunately, we just lost Seth Anderson a few weeks ago, who'd been a stalwart and person who was first in town,
right?
I think in '78, doing infectious diseases. So it was sad to see him.
Sad to see
pass.
him.
Yeah,
absolutely. Getting back to HIV, it seems now that huge progress has been made on treatment and suppression, and people being able to carry on normal lives after infection. What about vaccination? Was that ever getting close to success, or is it likely?
Are you talking about vaccinating to prevent HIV, or just vaccinating?
To prevent HIV.
Yeah, we really haven't come up with a good vaccine yet for HIV, and it has defied our ability to make vaccines. I mean, fortunately, COVID didn't defy that. We were relatively quick at being able to develop those vaccines, but we just don't have anything to prevent HIV in terms of vaccine. But we do have medicines available that we can give to folks who are engaging in high-risk sexual activity. They can actually prevent the acquisition, but it's a pill that they have to take right before and for a few days after any high-risk sexual contact. And that's actually been working out pretty good to do that. And then we also have some intramuscular medicines that can last for a month. They can provide protection over the course of a whole month without having to take the pills as well. So the pills are working to prevent it, but we don't have a good vaccine for HIV.
Herpes simplex. There were some things that happened recently to patients of mine where I saw a patient who looked as though she might have a herpes simplex virus, and a swab was done which was positive. We did an IgG and IgM at that time, both of which were negative, but I felt that was early in the course of things. Mm-hmm. And never in this case did we later do an IgG until maybe 3 years later, and IgG was negative. So my understanding, and obviously I'm not working in infectious disease all the time, was that IgG was the gold standard of diagnosis for HSV. In this case, the swab was positive, and the IgG never turned positive. So is that a false positive swab, or does something else? Can something else happen that?
But I have to say something, because I remember you saying at that time that the patient didn't present as though she had. You didn't think it was, so you were very shocked.
Yeah, right. I mean, there was definite lesions, but they didn't quite look right to me. In my very amateur impression of HSV appearances.
Right? Yeah,
that's
that was
right.
right.
That's absolutely right.
Part of it depends on what the test was that made you think it was herpes simplex. It was a PCR test, which is really high-level technology, and it's pretty definitive, and there are not many false positives with that. If it was a culture, that also is pretty definitive that it was actually there anyway. Sometimes if you just do a smear and see multinucleated giant cells, that's a little less specific than that. Okay. But we like to think, you're right, that anytime you've been exposed to an infection, you've got antibodies to it. I had chicken pox when I was little, and I know I still have antibodies to chicken pox, which was a virus that I got, and I know that I'm somewhat protected from it because I have those antibodies present. So usually people do develop antibodies, but sometimes people's immune systems, they develop antibodies, then they go away.
Okay.
That doesn't mean they don't have any immunity against it, but again, herpes simplex is a tough one because immunity doesn't protect you from recurrent infections anyway.
Right. And what about in a case like this that I described, what about transfer to other people? If my patient doesn't have the antibodies, is it in any way likely that there is still some dormant infection that could be shed at some time?
Yes, I think that's true. I mean, that's characteristic of all of the herpes infections, whether it's HSV1 or HSV2, is that it gets into the nerves and it can reactivate at any time. And when it reactivates, it certainly can be transmitted, but people may not have lesions to know that it's transmitted.
Right.
And that's one of the difficulties, because all you can tell people is that they're potentially at risk for reactivation and spreading it, and therefore they should use some kind of barrier protection to help prevent that spread.
Yeah. Okay.
It seems like, I have a daughter in the age group. I'm calling it the hookup age group, because they're just having sex. And I noticed it. She's 20, and not her, but like this age group. And I hear it, it's a very casual, no one's wearing protection. It's not, we're dating. It's no, mom, they just hooked up, and I'm looking at her like, wow, we grew up in the time of AIDS. Nobody was just hooking up. I mean, you had to go and get a test, or you asked the person you were seeing to go get a test, and then you had to wait in that little room to get the result of your test, and it was frightening. And I look at the kids today, and it's so casual, and I think their epidemic is HSV, but none of them seem to care that much if they get it or if they have it. It's really interesting.
It is, and I think with regard to certainly sexually transmitted diseases, I mean, we were all very concerned about HIV infection. I just admitted someone to the hospital recently, 22 years old with full-blown AIDS, who had been engaged in high-risk sexual activity and didn't even really think about the possibility of having AIDS and was not really familiar with what the disease was like. It's a brand new world, not necessarily a brave new world, but a brand new world in terms of the diagnosis of HIV or AIDS was a death sentence back in the 80s.
Yeah.
And now it's something that you're on medicines, the virus is suppressed, you can't spread it to other people, and you live a normal life. Duration of your life is normal as long as the virus is suppressed. And I think young people today don't have that fear because they haven't seen people dying around them as a result of HIV infection. And therefore, it's taken much more lightly because, I can take a pill and take care of it. It's not a big deal. But it does change your life, and it affects your ability to have kids who are not infected.
Yeah. Right.
and-
Well, it's a serious thing. I mean, it's frightening. It still scares me half to death. I mean, I think it's just, I'll never get over the fear of having the AIDS test and waiting to get pulled into the room to be given my result.
That was a common problem. And it was really people have PTSD about having an HIV test done.
Yes.
Wow.
Yes.
Turns out when people have HIV tests done at clinic, about half the people don't even come back for the results because they're so nervous about getting the results back,
Wow.
which is really sort of counterintuitive.
Right. But so that's what's really changed is that process of getting your result from way back when.
It has. And, there are clinics now, especially in San Francisco, where you can go in and you get same-day service. You can be diagnosed with HIV infection and you get started on medicines the same day because it's thought that anybody who has been exposed to HIV should be on treatment to prevent any further destruction of the immune system.
And those are all reported, right? That's like a reported, anyone that has HIV, you have to report that, right? That goes somewhere.
That's correct. It's reported to the Public Health Department.
Okay. So that's still monitored fairly well in terms of the peaks of how if people are getting it, like we can see if it's rising
Right.
or falling.
We can.
Yeah.
That's exactly right.
Yeah.
Keeping track of that. And there's still a steady number of people who get HIV every year. It's about 40 to 60,000 in the United States. People are still getting it, and that's because people are engaging in high-risk sexual activity and not taking protection.
Yeah, I don't like that about today's youth. They're just, I don't know if they're, I try to have these conversations with my daughter about, well, what is it? What is it? And it's just the way it is. They're just not being safe. So
It's not the first time kids have not been safe.
I know.
I think that's correct. And I think, they all think they're invulnerable and it's not going to happen to them.
Yeah.
Yeah.
And then when it does happen, it's a tragedy.
Yeah.
And
I have a question. Okay, so on your questionnaire, you were born and raised in Kentucky. So I want to hear a little bit about that and how you ended up at Harvard and Boston and how you ended up in Santa Barbara. So I want a little bit of a story here. So
I went to high school there, and I was planning on going to college in Kentucky because all my friends were back there, and I didn't have any great aspirations to go anywhere else. Plus, didn't have the money to pay to go someplace else. And during my senior year, one of the representatives from Harvard came by the school, and a bunch of my friends went down to the meeting. I didn't go to the meeting because I didn't really have any desire to go. And they asked the counselor who would be a good candidate to go, and they suggested that I might be. So they asked me to come down, and so I politely went down, listened, shook my head, and said, really, there's no way I could go to Boston. I'd never been outside of Kentucky at that time. And they said, if you can get in, we'll make sure you can finish.
Wow.
You don't have to worry about the money. And so I applied, and I luckily got in. And boy, it was an incredible experience and change in my life dramatically, leaving Kentucky and going to Boston.
I bet. And were you at that point in Kentucky interested in medicine, or did that happen in Boston?
Well, it actually happened in Boston because I was interested in going to chemistry. And my senior year of college, we were sitting around the lunchroom table. It was in November of 1968. I graduated in 1969. And so what asked me was, what was I going to do to keep from going to Vietnam? And it dawned on me, I knew what my draft number was, and I knew that they had gone through my draft number, so I knew that I was going to be selected. I came from the same draft area that Muhammad Ali came from, and they went after him, so I knew they were going to probably go after me as well. So that's when I decided to go into medicine, because I could be deferred from going to Vietnam. And if it wasn't for the Vietnam War, I probably would not have gone into medicine. And then once I got into medicine, I just fell in love with doing medicine. And
Wow. So it was just sort of by chance.
well, it was by chance, but then it was by intention when I realized what the consequences were
Yeah.
of not going to medical school.
And so what would you have gone into if you didn't go to medical school, do you think?
I wanted to do research in chemistry.
Okay. That's great.
Chemistry is my favorite subject, and love to do that.
So then you went to medical school.
Right.
And then,
Harvard Medical School,
Yeah.
and then went to Mass General Hospital, and then from there went to the NIH. And then the NIH was actually part of the Public Health Service, so the time that I spent there counted as my military service.
oh,
You played your cards right.
yeah.
I did. They called
Strategy.
us. We were the last of the Yellow Berets because we were at Public Health Service.
Yeah.
And you worked with Dr. Fauci.
I did.
Yeah.
We used to play basketball together.
So how did you end up in Santa Barbara?
Good buddy of mine, who we were interns and residents together in Boston, came out here as a cardiologist, and I actually came out to visit him, probably half a dozen times. And I'm telling you, every single time I was here, it was foggy and overcast, and I couldn't figure out what the big deal about Santa Barbara was. And then they needed somebody in Santa Barbara to do infectious diseases because Dr. Anderson was really the only one in town who was doing infectious disease. And I'd always been intrigued about coming to California because in college, medical school, residency, people from California always wanted to go back to California. People from other places would go back to where they came from because their family was there and it was easy. But I was curious about California, so I thought I was packed up and going to come to California and cure infectious diseases and learn how to windsurf. And
That's right. That was the windsurfing time
that's exactly
in
right.
Santa Barbara.
That's exactly right.
Yeah. I probably saw you down there because I was windsurfing as well.
Yeah, no, I think we were all down at Ledbetter
Yep.
Beach
Yep.
every weekend and
Yep.
spending the whole weekend down there.
I would get blown out and
Yeah.
someone would have to pick me up out there.
Right.
'Cause I wasn't strong enough to
Right.
get back to shore.
Yeah.
Was that Bill that brought you here?
Yeah, Bill Alton, right? Yeah.
Great.
Exactly. He was actually windsurfing too, and he got blown offshore, and actually some Vietnamese sailors picked him up. Our fishermen picked him up and brought him back in. We thought it was amusing that he was saved by some Vietnamese fishermen.
Really?
Yeah.
That's a great sport. And I, in doing some research about you, I also read about your passion for meditation and your time in Bali. And let's talk about that a little bit.
Sure. I went to Bali about 10 years ago now, and had no expectations other than it was a wonderful place to go. And we were essentially in ceremony from 8 in the morning to 8 at night, and that pretty much meant we were meditating or contemplating. Had incredible experiences with different people and healers that were there. I saw healing being practiced in ways that I never thought healing could occur in terms of how they could make a diagnosis. First day I was there, we were going to get a medical diagnosis from one of the priests, and he did something with, we took a look at my hands, and he looked at me and says, "You have inflammation in your intestines." And I was stunned, and the reason I was stunned because about 2 years before I'd had a colonoscopy and I found out I had Crohn's disease. Now, I hadn't been able to make that diagnosis through 30 years of being a physician, and it was made at a routine colonoscopy. And he took one look at my hand, something about my hands.
And what, could you see anything on your hands? Or was it
No,
just...
it was a crease that went farther than it should have gone or whatnot. And then he said, well, I'll give you something for it. And he, for the 12 days I was there, he would give me a smoothie in the morning and in the evening, and I had absolutely no symptoms. I was in a foreign country, developing nation, for 2 weeks and had no turista, no gastrointestinal problems at all. And I was amazed that somebody had the ability. We spend years training, doing CT scans
Right,
and
lab
lab
work,
tests and whatnot. And this guy just looked at me and my hands and could figure out what was going on. So it was a pretty profound experience to see how they practice medicine and healing in developing nations.
Were you at something for physicians, or were you just at a retreat, or?
It was more like a retreat, and it was designed to go into different villages and spend time in the villages. And the first night I was there, they had this huge ceremony, and someone came through somebody else who was someone who died 30 or 40 years ago, and she was speaking about this. And then at the end of it, they had a ceremony, and then the music started, and they told us we'll just go with the music. And so we're sort of standing there listening to music, and people are transforming into animals and making animal-like sounds and crawling around like an animal. We're clearly in trance. And I thought, I'm so excited about this, I can't really concentrate. So I just closed my eyes, and I was just went with the music or whatnot. And after a period of time, I don't know what happened exactly, and there was no substance involved. Nobody was smoking anything or took any pills or anything. Somebody came up and gave me like a little Heimlich maneuver, and I opened my eyes. When I opened my eyes, everybody who was there was smiling and looking at me. The music had stopped 15 minutes before, and I was in deep trance and gone someplace else, and they were able to bring me back. So that was the power of that experience. And when you're around people, you sort of get entrained into their thought processes and the energy that they have about them. Mm-hmm. And it was a profound experience for me. And I came back and I thought, there's no way I can tell anybody about this, but I have. And people listen and shake their heads. I don't know if they believe me or not, but it was pretty
believe
profound.
You. I believe it. I think it's such a great story. And it's, you were, Western medicine trained. So you kind of already have this thing where you have your belief system, right?
Right.
So
it's a pretty rigid belief system, too.
Exactly. So for someone like you to go there and have this experience, it must have been, really powerful. And then you came back, and you've still kept meditation a part of your life, right?
Yes, and when I came back, I was like floating when I came back into the hospital, and I would walk into a patient's room and I could just tell exactly what was going on in the situation, what was going to happen, and I could talk to families and tell them what was going to transpire. It's like I was just very mindful and conscious of all that was going on. And that lasted for about 3 months, and then I gradually lost it. And I thought, geez, I need to go back to Bali and get another dose of this. And some good friends reminded me that that was just like any other addiction. You go someplace else to get feeling a certain way, and you had to do this yourself. And the best way to do that was by meditation. And so that's when I got into meditation. I meditate every day. And the days I meditate are different than the days I don't meditate.
Wow.
And I pretty much don't miss a day.
Yeah. And is that meditation for you is it sitting? Is it laying? I've always had a hard time meditating because I feel like my mind always just takes it over, and I can't get really quiet. But sometimes when I'm on a walk, I find myself meditating where I can just shut everything.
Yeah, I think there are all sorts of ways to meditate. Whatever you do and you get lost into, it's like a meditation. And the practice of everybody's mind, everybody has monkey mind that wants to take it over and take over. But if you practice that, then when something happens in your life, you can you can realize what's happening, you can see what's happening, and you can respond consciously rather than reflexly. I can remember one time that was working with the residents, and they had done something that was really harmful to a close friend and patient of mine. And I initially started to react, but I took a deep breath and I realized, oh. And I took a breath and I said, let's talk about this at a later time, because right now wouldn't be a good time to talk about it, because I was so emotionally responding to what had happened. And it was a great example of what meditation can do for you. It's like running a marathon. You don't go run a marathon. You work up to it, and you start maybe 5 minutes a day trying, then move to 10 minutes, 30 minutes. And the more you practice, the more you're able to do that and be conscious of how you're responding to what's going on in your world.
Yeah. Well, Duncan, you got really good at meditating for a while, I remember.
Yeah, absolutely. And I mean, just seeing that in your response to our questions was a trigger for me to get more involved and get mindful again. And I actually sort of have a list of things I have to do every day, and right at the top of the list is mindfulness. But I haven't been really, let's say, regular in doing that. But this has started me thinking about it again. Or just, I read a book fairly recently, a couple of years ago, called Thinking Fast and Thinking Slow. And it just talked about our responses, how we work as human beings. And the fast, which is the easy way to do it, is just we react. And we do things that are that seem to be the thing to do right away. And thinking slow takes more effort and more in-depth thinking, and is usually the right way to go.
Right.
But it was again, it sort of encompasses to me the same aspect of quiet and mindfulness, of just being able. It's when I was sort of learning how to do this, it was thinking about thinking. Being aware that now I'm thinking, as opposed to just thinking. And so it's so I appreciate hearing this coming from you, because I respect you so much, and just saying, I need to get back on track. So it's good. Excellent.
I have to do it first thing in the morning, because if I don't do it first thing in the morning, the day gets away from me, and I always have something else I got to do, and I can't. But the first thing in the morning, the house is quiet, and I get up and have the time to myself.
Yeah, the mornings are so precious. I just think it's great. Mornings are my favorite time.
Yeah.
We're in such a really good space at this moment. I hesitate to bring up my next question for you, but I'm going to do it anyway, because I've wanted to speak to somebody with your knowledge and your experience about how COVID was handled. And you must be tired of talking about this, and I apologize, but I want to know, what did we do right? What did we do wrong? What would we do again differently? And the way it's going. And I apologize for the question. But
it's actually a good question, because there will be another epidemic of something. And there's been a new virus identified recently that's increasing, and we're thinking that there may be another surge that's going to be coming, maybe in the autumn, certainly in the winter potentially. I think it's really about information. And, it took a long time from when the first cases were discovered in China for there was any response to say, maybe we need to do something about trying to limit the spread of this, because with international travel, things travel around the world in 24 hours.
Yeah.
And to think that this virus has actually gone around the globe 5 separate times in 5 different ways, infecting people and changing people. I think if you know what's going on, you can better respond to it. And we really didn't know what was going on until we started seeing it here, probably in March or so, after the November, December, when it was in China, anyway. So I think a global response, and there's a sort of a mantra of 171, like you identify it, then after a week you're sure that it's happening, and then you make a response so that you can stop it. Because once it gets going, by the time it gets going and you identify one patient, there are 100 patients that already have it that you don't know about it. Right. And it's already spreading. And it's really the cat's out of the bag, horses out of the barn, whatever you want to say it, because you can't control it then. So it's really about communication and a world network. It's like we have the CDC here that does really good for the United States, but you need a CDC for the globe.
Right.
So you know what's going on, whether it's Ebola in Africa or Zika in South America or COVID or monkeypox. I mean, all those things are around, and there's so many options for infectious diseases to spread relatively rapidly.
Yeah. Then if so communication and open-mindedness to this reality is important, and acting quickly. But the vaccines have made the complete difference to COVID and some sort of semblance of control.
Yes.
What about the controversial things like masks and isolation and
locking down, no travel?
The changes that we went through blindly, really, initially.
Right.
What do we learn in that regard?
Well, I think I think we know for sure that there's no question that appropriate N95 masks can decrease the transmission or acquisition of the virus. As it becomes more infectious, they become maybe a little less effective than they were initially, but they do work until you figure out what's going on.
Right.
Being in groups in a closed area, that's high risk for transmitting the virus.
Yeah.
And for a while, you pretty much had to be inside. You didn't have to worry about it being outside. Mm-hmm. And actually, about a year ago, I had a gathering at my house outside because to get the residents together, because they hadn't been able to get together because of COVID anyway. And I actually had it outside, and I realized I had sponsored a super spreader event because one of the residents came and had been exposed to his mother who had it, and it was the really catchy kind of virus, Omicron, which is circulating now, and 10 of the residents got the virus, and me got the virus.
Oh my God.
It's sort of bad PR for an infectious disease doctor to sponsor a super spreader event.
But it's a good story. That's relatable.
And I realized that it becomes so infectious that it could be spread outside. And that's because it only took a few little viral particles to start an infection. But the infections that we have now, they're much less deadly than they were when we started out.
Right.
So there are a lot more people that are getting it, but they don't seem to be dying from it. And the other part of this is I have to say that 95% of the people who die in the United States have not received the vaccine.
95% of them.
95%. Wow. So, you really, to hedge your bets, you want to have the vaccine on board. But if your immune system doesn't work, or you can't make antibodies, like the person who couldn't make antibodies to herpes simplex, then you're not protected.
Right.
So there are a lot of people around whose immune systems don't work, and those are the ones you have to try and protect by herd immunity, so everybody around them is protected, and so it's not spread.
So with this recent variant, do you anticipate another vaccination?
I think there will have to be, because the data that I have seen is that the antibodies from the vaccines that we have no activity against the new virus that's coming.
What's the new virus that's coming? Does it have a name yet?
It's, I think Eris is the one I've seen. It's a new subset of the Omicron virus, and it's each of these viruses mutate in a way that elude the immune system, or the natural immune system, to fight it. I did see an article recently where they had developed some antibodies or immunity that had broad activity against across all the coronaviruses. So if you can get a different kind of vaccine that works against all the different kinds of coronaviruses, that's what we'd really like to have. But natural selection selects for those that can evade the immunity, and that's what they do. They don't allow the antibodies to neutralize them.
And we were all pretty much on the medical staff of college was pretty much on board, or had to be, in terms of getting vaccination. Is there a suggestion that doing the vaccination, getting the most up to date one every 6 months, 12 months, is the right way to go at this point?
We don't have data. And part of the reason, and this is a common question I get asked, should I get the vaccine? It's available. Well, I tell people, my understanding is that the vaccine efficacy lasts about 2 months. So you get the vaccine now and there's not much virus circulating, I think you waste getting the vaccine. If you know that there's something that's showing up on the East Coast or someplace else, the activity is increasing, that's the time to get the vaccine to maximize your immunity when you're going to be potentially exposed to it.
Yeah. But
that's one of the problems is the virus changes so quickly. We have to keep up with it by changing the vaccine.
Yeah.
But the antivirals still work.
Yeah.
The Paxlovid, the pills that you can get from the pharmacy still work, and the medicines we give in the hospital, remdesivir, still work against the virus. So that's one redeeming factor, but it's just the immunity may decrease efficacy.
How are you for questions? Are you questioning that?
Well, I could spend all day, but maybe we can get together another time. I love the fun fact about you that you share puns with anyone and everyone.
It's known as punishment.
My first knowledge of a pun was when I was about 12, when my parents had some friends over and they were playing a game of thinking of puns, and I was in the room, and they said not quietly, sort of cautiously, Duncan may not want to hear this, but the example of a pun was, dung can make the grass grow. So I always remember what a pun was. Okay.
Yeah, exactly.
Yeah,
exactly.
Anything else that you'd like to express to our listeners of any little gem? I think you've given so many at this point. Anything else you think we're missing?
Well, it's unfortunate that this has become a lot of the vaccine information and medical information has been politicized.
Oh gosh, yes.
And so it's not a matter of the science and following the science or the data that we know, but anybody who has a recording device can go on the internet and make claims about different things that seem to work. And we look backwards at a lot of those medicines that people were asking for just don't have any efficacy at all. And there really wasn't really strong data. But people hear something, and in desperate times, you'll seek out whatever you can because we don't know. I can remember before we had the antiretroviral drugs, I was talking to people about things that they were getting from Mexico or things that seemed to me may work anyway or not. Yeah. And, sometimes I think some of those did have some efficacy, but I think that what people were mobilizing was their belief system. And when you believe in something, you seem to get it's a placebo effect, but it's a true effect because you're aligned and you're doing something, you believe you're doing something, and your body gets in sync with that, and it allows you to fight infection or be healthier if you believe in what you're doing. It's better to have belief in something that has been shown to actually work. And the problem is, when you get an epidemic like this, you got a lot of different people who are saying a lot of different things. And how do you decide what's right for you and what's not right?
I must admit that I became very frustrated and tired at what a bashing the medical profession got through all of that.
I agree with you.
Steve Hosea, thank you so much for being on the Vagina Doctor podcast.
So welcome. Thanks for having me. Enjoyed it.
Great. We'd really appreciate a review on Apple Podcast, Spotify, or wherever you're listening. Thank you. You can always DM the Vagina Doctor Instagram with any questions or topics you'd like to learn more about, or email us. The Vagina Doctor Podcast. It all starts here.